First case on-time starts are a major challenge for us throughout the operating room. And it's a challenge for a lot of reasons.
For every surgery that happens, we have a whole bunch of different stakeholders that come together to care for the patient.
Including people like the folks who clean the room, the anesthesiologists, the surgeons, the pre-op nurses, and the recovery room nurses, all in one team so that they can follow the transit of the patient through the various stages of care in the operating room.
And using TigerConnect, we're able to quickly communicate with whoever is assigned to that case for that day, which sometimes can change multiple times throughout the day.
About a year ago, we had sat down with the perioperative services and their leadership to figure out what some of the pain points were that they were facing. And it became very clear that there was a very wasteful process of 17 different landline phone calls being made as a patient moved through that life cycle of the OR. And so what we did was start a project where we integrated TigerConnect with our electronic medical record, Epic, such that events that the nurses were already documenting in the EMR as part of their daily workflow were generating notifications to Tiger, to all the right members of that OR care team, indicating where a patient was in that life cycle. And as the patient moved through those different steps, different notifications would be sent out indicating that it was the right time for the anesthesiologist to come in, or for the surgeon to come in, or for the OR tech to come in. And so we eliminated all 17 of those phone calls without adding any additional work to the OR staff. And I think that that's very important.
There should not be a need for individual phone calls to the surgical attending, the surgical resident, the PA, the nurse. All of those used to be actual individual text messages, phone calls, shouting in the hallway, whatever it might be. All of that is now happening automatically in TigerConnect.
And so with these 8 different event-driven notifications that go out to Tiger, we asked the question, what metrics do we need to be following to figure out whether or not that's actually improving throughput? And one of the metrics that the OR staff really follows is the first case on-time starts. And so when we implemented this integration between the EMR and Tiger, after a couple months with the addition of their own internal pilot of staggering some of the OR start times, we saw a 70% increase in the first case on-time start rate for the OR.